Hello, everybody, and good afternoon, and welcome to our webinar today. My name is Otieno. I am from the Knowledge Success Project based at the Secretariat, which is based at AMREF's Institute of Capacity Development. I am excited to be part of the team that has been working closely with the steering committee for the collaborative to organize this very exciting conversations that we are excited about, and we think it's timely in our region. And welcome all of you to it. As we start into it, we have a great team of speakers who are members of our collaborative, people you know or might have seen or interacted with on the WhatsApp platforms. So we welcome you to also get to able to contribute to our conversation today. And it's just the beginning. It won't be the end, because this is also our way of contributing to the global conversations that are happening. To start us off,
Kiss, baby.
yes, the music still wants to take us there. So as we start up off, and I see we have quite a good number already joined. Just to have to know who is in the room. I see you all are putting your names. I know some have interesting names that in case I have a challenge pronouncing, please forgive me. But welcome to all. We want to have a sense of where you're joining us from. Currently, I'm joining you from Nairobi, Kenya. We want you to type in the chat, just write in the chat box the country where you are joining from, so that then we know who's in the room, which country is represented, because the collaborative is our East Africa Community of Practice, and it has membership from different countries within the East Africa region, but even broadly within the continent. So just typing in the chat the country you are from, and we want to be able to, through some also use of tech and whatnot, to get to see just who's in the room and the people who are in there. We are about to open the chat in a few. Oh, sorry, I see that the chat is disabled. Give me a second. Are you having access now? So sorry about that. We'll get to, as we are going to sort it out, but let's just continue for the purpose, for the benefit of time, and to also just respect your time. We are going to just go straight to it as we try to sort access to the chats. So if you can hear me and if you can see the screen, put on a thumbs up sign or something like that. But So as a start, I think we want to share just these are things that we all do, but just to respect everyone and just have some good ways of operating. We are going to respect some of the norms that are going to guide us today. Is we respect your time and availability, and we do know that with some of you and majority of you, even for those who might not be able to work from home or are working from home, there are some uncertainty. So we are sensitive to that. For the moment, all attendees, everyone is on mute. But then at some point we will opening up for engagement. But then in case you want to ask a question or any comments, we'll still put the chats open. We'll try to sort that one out. But in case you want to speak, just raise your hand and someone will be able to unmute you. And that we have a Q&A box where you can put in all your questions so that then they can be addressed. And feel free to put these questions at any time as our discussions are going on, so that then we'll get to also respond to them. And this also as part of you contributing. So we look forward to part of our engagement. We are hoping to make this as interactive as possible so that it's both sides of, we're here to get both sides of the conversation. We are hoping this will just be a 90-minute session. And trust you me, 90 minutes will move very fast. So we together with the beautiful speakers here, we are going to try to observe our time during the session. We hope that and our guidance is we be able to respect each other's opinions, that we are all experts in our own realm and space, that we are not the sole owners of knowledge. And the value of this conversation is that we're going to get these insights and opinions from different parts of our region, East Africa, but don't even different parts and experiences from the rest of the world. Our hashtag for the day today is Tech and GBV, but we'll also put it in the chat so that then in case some of you are also interacting and sharing this and some of the snippets and insights you're having from the social media platforms, feel free to tag at AmrefICD. If it's on X, I know some of you have also known some of our speakers today. They're your friends, your colleagues, but then once you start that, we'll always be able to retag and connect with you all. So these are some of the conversations that we're guiding us for today. So a little bit of we are here. So this webinar is brought to you courtesy of the collaborative. So our collaborative is our community of practice of family planning, made up of family planning, sexual reproductive health enthusiasts, advocates, program managers, implementers, funders, you name it. And the word that we like using to describe all these people, and that's why he started with this word, is enthusiast. So if you're involved in the field of family planning, sexual reproductive health, you are welcome to be a member of this collaborative. And one of the things that bring us together is that then we use the opportunity as members of the collaborative to actually engage and interact and learn about different knowledge management practices that then we can use in our work to be able to do more, share more, and learn more, to be able to apply it in our work, apply it in our day-to-day interventions, appreciate some of these knowledge management practices. And essentially, we're talking about how do we share knowledge, how do we synthesize knowledge, how do we capture knowledge and document it for the future generations, and how do we get the knowledge and our experiences from tacit knowledge, which is essentially the things that are in our minds and the experiences in a way that then can inform our day-to-day practice. And like I said, in summary, that is who we are. It's a network of KM champions, stakeholders in Africa and beyond. Currently, we have a membership of over 400 members across not just East Africa countries, other countries. So we are talking about Kenya, Uganda, Rwanda, Tanzania, Ethiopia, Malawi, Zambia, Ghana, Nigeria. We have Ivory Coast, Liberia in the mix. We have Niger, a few people from there. So you see it's broad. We have a couple of folks from the US, from India, from UK. But then we started it because of technology. We say its membership was East Africa, but of course it goes broadly as possible. We do have a steering committee who are actually elected from these members organizations that I've mentioned, specifically the East Africa one, that is Kenya, Rwanda, Uganda, Tanzania. And these members then help us to run the affairs of the community of practice. We have quarterly meetings with the membership, and we also have engagements on the online platforms, which are both on WhatsApp, and we have our webpage platform that when we constantly engage and interact. So we welcome you all to be and come and join these collaborative members of practice if you are not a member. But then it's an interesting place for interaction, and as a member, I've managed to meet people, connect with them, learn about work they are doing, and know what is happening in the field of SRH in its specific and in its broadest sense across the region. So I will not, I want to throw it back to how the meat of the conversation. So to the person who will be guiding this ship today, we are very happy to have as a moderator one of our very own. And I mean, when I say our very own, I mean a member of the collaborative. And we have Phidilliah Rose Mwaambi, and I have the honor of Mwaambi, and I have the honor of introducing her. So Phidilliah is actually a health consultant. She's based in Kenya, and she has a proven track record in strengthening health systems. So when you talk about health systems strengthening, that's her tea and a butter, and she loves that. She's like a fish in water in that space. She's a strong advocate for advocating for policy change, prioritizing aspects of community health services, working the space of gender violence prevention. She's a strategist and has designed quite a number of strategic frameworks, and she's established and managed a stakeholder partnership both at public sector and with private sector. Phidilliah is also committed to sustainable change. So she's always looking for opportunities to leverage open dialogue, active listening, and that expertise has helped her to be able to drive impactful results in the health industry. So for allow me and join me in welcoming Phidilliah, who's the moderator for this session, and I wanted to hand it over to her to take us from here. Karibu sana Phidilliah, the floor is yours.
Thank you so much, Collins. That's quite an introduction. How's everyone? A great thank you to our participants who are joining us, and also the members. I hope you can hear me clearly. Today we have quite a nice webinar discussion that is going to also be our discussion throughout the month as part of the collaborative members, and we would like you to give us your opinion, your thoughts, or the first thing that comes into your mind when we are talking about tech facilitated gender-based violence. So as we all share our insights and our understanding on tech facilitated GBV, I would like to share some of the objectives that we are seeking and hoping that we can be able to achieve as part of the outcome. And this is not limited to the shared learnings and contribution in the nexus between sexual reproductive health and tech facilitated GBV, to see how they're all integrated and they speak to each other, and also see how the aspects on how your areas of operation in countries, taking in consideration on the learnings and the experiences from your countries, and also understanding the existing structures and actions and interventions that are currently in our countries and our areas of operation that address the tech facilitated GBV, and shed light on what needs to be done, what tools need to be developed, and also share insights on solutions that can be easily adapted. And for the panelists who will be guiding our discussions today, giving a preview of them, we have Dr. Katanta Simwanza from Tanzania. We have Edith Atim from Uganda, Annonciata Mukayitete from Rwanda, Tonny Olela from Kenya, and Dr. Evode Niyibizi from Rwanda. We'll be sharing with you a small snippet of a video on what tech facilitated GBV is. I would like you to engage with it, and as you engage with it, share with us your opinions on what rings a bell and gives you an epiphany moment when you get to see the video. Collins, please share with us the videos, play the video.
Cyberbullying,
Cyber violence,
online harassment, child porn,
sextortion,
online trafficking. These are all forms of violent behaviors that occur in digital spaces.
that disproportionately affects women and girls.
Globally, 85% of women and girls have reported witnessing online violence. Nearly 40% have experienced it personally, and this trend is increasing daily.
Over half of women globally have experienced video and image-based abuse, and even more have suffered from astroturfing, where damaging content is shared concurrently across platforms.
These statistics do not capture the severe impact it has on survivors or convey the link between online and offline violence.
So it was that brief, I know. And I'm going to play it again for the purposes of those who feel it just ended.
Oh yeah, it's okay.
Cyberbullying,
Cyber violence,
online harassment, child porn,
sextortion,
online trafficking. These are all forms of violent behaviors that occur in digital spaces.
that disproportionately affects women and girls.
Globally, 85% of women and girls have reported witnessing online violence. Nearly 40% have experienced it personally, and this trend is increasing daily.
Over half of women globally have experienced video and image-based abuse, and even more have suffered from astroturfing, where damaging content is shared concurrently across platforms.
These statistics do not capture the severe impact it has on survivors or convey the link between online and offline violence.
That was a short video, but I hope it was informative to everyone. And we would like to still hear from you, your understanding and what your definition is of technology facilitated gender-based violence. Please share it in our chat, and we will also be taking in questions as the panelists take up their presentations and share with us the knowledge and the insights that they have in the space that they operate in. Allow me to now introduce our first panelist, and that is Mrs. Lady Edith Atim. She's from Uganda. Mrs. Edith is a human rights lawyer by profession, and she promotes gender equality among women in Agogo. She has over 5 years of working experience in the field of human rights, and she's also a writer and a poet and a book reviewer. Mrs. Edith, over to you.
Yeah, thank you so much for this opportunity. I'm very glad to share with you. I hope you can hear me well.
Yes, I can.
In Uganda, in the context of Uganda, okay, let me start by saying I won't be showing my face. I don't know if that is fine. Yeah. In Uganda, statistics from the United Nations Women show that 1 in 3 women in Uganda have experienced online technical gender-based violence. Online technical gender-based violence, as I understand, is violence, harassment, on abuse. This is violence, harassment, on abuse facilitated through digital technologies like social media, mobile devices, online forms, virtual reality, and many others. For us in Uganda, 1 in 3 women have experienced online sexual violence, online digital gender-based violence. 70% of these who have experienced this are mostly women journalists, yes, in the country. And then, according to the Institute of Development Studies, reports show that 16 to 58% of women have faced technical facilitated gender-based violence. This is not good. This is really not good because it has severe effects on our emotions, on our psychology. It has physical consequences for survivors. These forms are online harassment, cyberbullying, revenge porn, online stalking, and many others. And we have got to realize that there are many factors which cause these things. Yes, like limited digital literacy. So what I can say is that we have to intervene as people. We have to intervene as tech companies. Yes, we have to strengthen frameworks. That is what I can say in Uganda. Yeah, thank you so much.
Thank you so much, Edith. Would like to take any question. Collins, do we have any questions or any shared statements that we can pose to Miss Edith before we go to our next panelists? Just to share that we are going to have a very interactive Q&A session after the panelists have all presented their discussion points. And we'll be able to make it more conversational and also carry on the conversation post the webinar. So feel free to send in your questions and we will direct them to the panelists for them to share their insights and their 2 cents. Collins, do we have any questions?
No questions at the moment. Just Kundan was actually contributing and saying for them, I think a question about what their view about GBV or to the understanding of technology facilitated GBV, and it's a child is saying any sort of gender-based violence done through or using technology and social media. So thank you for that contribution. Anyone else, feel free to write in what your own understanding or view of TF-GBV is into the chat. Thank you.
Okay. We shall bring in forth our next panelist, and that is Dr. Katanta Simwanza. Dr. Katanta is from Tanzania and is a distinguished expert in public health and gender equality in social development. He has a lot of extensive experience in child safeguarding. And besides that, he also has experience in family planning, marriage counseling, and has successfully implemented engagement programs and also founded the Tanzanian Boys and Men's Ambassadors Platform. We'd like to welcome Dr. Katanta to take us through his discussion points and enrich us in our knowledge on tech facilitated GBV.
Thank you, Phidilliah, and good afternoon to all participants and panelists, and a greeting from Tanzania, tuko poa kabisa. So, as the first panelist started by introducing the concept of technology-facilitated gender-based violence, we are seeing in our context, technology has both sides. It has opportunity, but also it has created a number of problems in our context and globally. We have seen a number of children. We have a report I will share, which have been done by the Ministry of Community Development and Children in a collaboration of UNICEF. A number of young people, particularly children, boys and girls, have been violated. And as we understand, the concept of technology facilitated gender-based violence, it comprises spectrums of behavior which include stalking, bullying, sexual harassment, defamations, hate speech, exploitations. And for my colleague in Tanzania, as I understand, recently we have been experiencing something called connections, where it's like a gang rape, or sometimes someone is having an affair with someone, they think they're in private, but later on they record and release it, and it goes viral in the community. We have experienced a number of such kind of incidences which have very bad outcomes, some of which has ended people to hang themselves, hatred, and such kind of conflict. So to address this kind of challenge, the government, the key actors have come with different approaches using the same technology to address different challenges which are happening. And looking into the culture and the infrastructure installed base in the country of using the technology, we come to realize there are different number of platforms which have been used. And the designing and the implementation of it, basically they're using one of the best model of behavior change, the social ecological model, applying trans-theoretical model on which is talking from the pre-contemplation level to the actions, and from unaware stage to awareness stage, and targeting individual, families, couples, communities, institutions, and the legal framework per se at all. For example, we have something called Haki Kiganjani. This is under Legal Human Rights Center. Is more of GBV responses, is a number, which is 0699695486. It can be used offline. You don't need to have a smartphone, but just normal phone. You just report the number. You just send the message through the number, and such kind of message, it will be triaged, and they'll know what is the kind of problem is happening. And within a few minutes, you'll get a response. The triage will be done, and you'll be directed where to go. Recently, for example, in Tanzania, over the weekend, last weekend, there was a gang rape whereby good people, the human rights monitors, the paralegals, the individuals, they just reported about the incidences, and they even managed to record what was happening. A certain lady was being raped, and the information was shared. And currently, as we are speaking, the response is very good. You can see the Attorney General, the President, the key actors, Legal Human Rights Center, they've all made statements, the police itself. So the implicated perpetrators now are held accountable, but at the same time, the survivor now is getting the services. We have some sad stories, but there are success stories which have been documented. For example, during the vacation for when the school was closed, we managed to hold sessions with children somewhere, and we are talking about the incidences of GBV. And you remember one of the kids reported a girl, she's 8, that she had been raped by his father several times for several months. She told us, but she was seeking for support. We told her what to do. And when she went back, we just gave her a number of one of the app. And when she went back home, when that kind of stuff was happening, she just sent a message telling us the guy is trying to do the stuff. And later on, she told us he has managed to do it. From the guidance which we have provided, from when she sent the message, the mobilizations of technical staffs, police, social welfare, activists were all around there, and the guy was handed, we hold him, and now the thing is going on. So in a country, just to make it short, for example, in one of the regions in Singida, there is an organization which is having a very strong app, which is called Mobile Tracking Systems. They're just having a number 0710567003, whereby people are just sending the number, they're just sending the message. From the GBV service directory, which they have, they managed they do a triage and to know the kind of the cases which have been reported, and direct the system will make a referral. And if there is any sort of delay, it will go to another level. So within 30 minutes, the response is already happening. And we are very happy to see this tracking system has managed to save a number of children, especially girl child, when they are about to get maturated, when they were forced to get married, and such kind of stuff. So as I mentioned, the designing of this app in the country is starting from individual to the family, is talking about the use of digital tools to enhance GBV preventions and response. But also the second strategy, they reduce GBV risk in the digital programming. For example, we have Sheria Kiganjani app. This is mainly for just giving the informations. If there's any sort of violation of human right, you just go to this app. They will tell you what to do and what kind of actions, where to go, who will support you, and what should be done and what should not be done. So this is just for preventions and giving people, empowering people with the informations. But at the same time, there is another one which is more of preventing and mitigation and response. For example, the tangible initiative. This is more of helping local organization, individuals to design some of the programs which they can use the informations. And we witness even individuals. For example, there is a certain activist, a colleague called Godrisen Malisa. He is very powerful. He's using his social media handles, particularly Instagram and Twitter, to report and to play devil role by informing the community, by informing the government and other key actors on various issues around the GBV violation of human rights. And for Tanzanian, even other folks, if you may need to go to that social media account, you can attest yourself that he is doing a great job in the country. He has saved a number of people from public health service to the violation of human rights. Yeah, so let me stop here. I'll make much more contribution later on when we continue the discussions. But importantly, just to know, even the government, I won't be fair if I don't mention the government. The government also have an app. It's called the PCCB app, which this is for sextortions, corruptions, raping, such kind of stuff. This is an app, but also they have a number, 113. If you call, they will pick it. The government also have another number, which is 115, 116. All of these are mobile numbers which are using technology to respond and to provide support to the community members. So let me stop here to provide space for other folks to talk, but I'll make much more contribution as we go along. Thank you, guys.
Thank you so much, Dr. Katanta, for your insight. It's good to know the preventative measures that you can take towards the tech-facilitated GBV. Thank you for also sharing with us the reality as it is on the ground with some good examples that you can learn from and we can borrow from. These are conversations that we are looking forward to having with you during our Q&A session. Allow me to please bring in Miss Annonciata from Rwanda, who has worked as a regional project coordinator of the Discriminatory Population Support Project in the Great Lakes region, and also coordinates an EU-funded project that focuses on capacity building for key populations in Rwanda. And she has this great vision of promoting health and the rights of vulnerable people and marginalized groups. And I'm for sure the gender-based violence survivors are also part of the group that she reaches out to for their well-being and self-promotion. Please, Ms. Annonciata, share with us what you have for today.
Thank you very much. As the precedent speakers have said, in Rwanda, as all over the world, the issue of technology has also been there. And even if Rwanda has seen a significant increase in internet and mobile phone usage, for example, as of 2023, over 7 million Rwandans use the internet with social media engagement. As many of you know, Rwanda has made strides in gender equality, and is in that context ranking highly in gender parity indices. However, social cultural norms still pose challenges for women and girls and gender minorities. As they have said, I really focus on sexual minorities' rights, and they face a serious issue of technology facilitated. We see the kind of types of technology facilitated they face, which makes them more vulnerable in the community. Among kind of or types of technology facilitated violence they face, I can highlight online harassment, which includes abusive messages, threats, and derogatory comments. And studies show that 35% of Rwandan women have experienced online harassment in Rwanda. Those are mostly feminist activists and human rights defenders, especially under the sexual minorities group. There is also another form of cyberstalking, where persistent monitoring of victims online. And according to research, ex-partners frequently use social media to track and harass their victims. We have seen, for example, separated couples or divorced couples where the partner continue to track and harass the person they already separated with. There is also another type of non-consensual sharing of intimate images, where private images are shared without consent. I think other speakers have talked about, and where victims also often face severe emotional and social deprivation. Because once a photo of someone is posted on social media, on YouTube, then it has an impact offline. It is done online, but it has an impact offline. Exactly the issues we face regarding physical violence, mental violence, or economic or sexual violence. So there is also another form of doxing. It's called doxing, where there is a release of personal information online with malicious intent, and which can lead to physical harm, social activity, and economic losses, especially towards the LGBT community or sexual minorities. There is an issue of hate speeches against people from the LGBT community. They are called like names, like caste people, people against the culture, people against the God's will, you know, those forms of hate speeches that made the LGBT community or sexual minorities groups more vulnerable. So I can say that the concept of technology facilitating violence in Rwanda is like somehow a new concept, because it was not part of the violence, the types of violence identified in the GBV law in Rwanda. The reason why, because the current GBV law, that's 2008, so it is under review now, and we have the opportunity to be one of the organizations as HDI Development Initiative to give our input to the law, and we have suggested that technology.
Annonciata,
yes, please.
Will we just be vigilant on the time? We have a few minutes. We are shortened the time, and we would like to engage the participants in the Q&A, and you can be able to share more. So if you could please hasten up and finish your presentation.
Yeah, I was about to finish. I said that we have had an opportunity to influence the current law under review GBV to integrate the issue of technology facilitated GBV. Thank you.
Okay, thank you so much. I think one of our last presenter, that is Tonny Olela, who has a background in Mr. Tonny Olela, who is a development professional with over 5 years in program management, program development, and partnership building, who is joining us with sharing his focus and insights on gender mainstreaming, SRHR, and GBV. He serves as an advisory board member and champions for powerful advocacy and awareness and impact across governments and organizations for a gender equal future. So please, Tonny Olela, take the way. Mr. Tonny Olela, will you?
Yeah, can you hear me?
Yes, I can. Sure.
All right. Thank you so much. So my colleagues have been able to really take us through the presentation, and I'll take this a bit very fast, but I request my audience to be very keen on the slides. So just to start on, as I've introduced, that's my name, Olela Tonny, and this just gives a brief summary of the statistics that we have in regards to TF-GBV. Basically, this is more into Kenya, and let's see how we can explore into technology, press, and gender-based violence. So I know we use different social media platforms to express ourselves, to do the posting, to drive campaign. But the question is, how do you effectively maximize on those platforms? And some of the things that you, fellow colleagues, use social media to create content. Some use it for betting, holding webinars. But now let's see the impact of technology on gender-based violence. This is by understanding how technology both empowers and harms us as individuals. So I'm just going to dive deep into what is OSEA. This is online sexual exploitation abuse. So these are refers to the crimes that are being committed by the use of internet, and we are the people who maximize on these platforms to sometimes create these crimes and end up even falling into victims. So what are some of the examples of online sexual exploitation abuse? Some were mentioned by my other colleague, that is child sexual abuse materials like child porn, online grooming, sexting, sexual exploitation, and live streaming of sexual abuse. So I'm not going to delve deep into each and every of these, but I'm just going to talk a little bit about sexting. So sexting, this is sending, receiving, and forwarding sexually explicit messages, photos, usually by by use of phones, or rather on any other device that you guys maximize on. So other forms of online threats are cyberbullying, identity theft, internet addiction, among others that you can see on the slides. So jumping into the reporting mechanisms. So basically, this is giving a context of Kenya. So in Kenya, we have different ways in which you can report a case if you are violated online. Okay, so we have the DCA reporting to DCI HTCPU, and this is the toll-free number, the 008 0888 0800. And then also, if you click on this link and go into their website, into the KeySite website, you're able to report the issues there. Also, we also have toll-free numbers and also other free safe spaces in Kenya. So how best can you keep yourself safe online? These are the online safety measures. So one, you need to be very courteous. Remember everyone, also remember that everything that you post can be traced back. Online never forgets, and think twice before you click the button send. Do not post anything. Okay, first of all, analyze what you want to post online to make it content friendly to your audience. Also, ensure that your private settings are secure and don't share with everyone everything. Just a quote that let's empower women and men, let's stop violence, let's create change. Together we can make a difference. And just onto the last bit of my presentation on how best can you be smart. Okay, tips on how to prevent yourself from any kind of online sexual exploitation, or rather TF-GBV. First of all, you need to set your limit. Set your limits with whatever you post online. Don't just post anything for the sake of posting. Don't just retweet anything, or rather reshare anything for the sake of doing so. Also, meeting people. I know we have the dating sites, we have people meeting online, people meeting on Telegram. But the thing is, before you do that, think twice before meeting people that you meet online in real life. If you feel like meeting someone, please accompany yourself with either a parent, a friend, or anyone whom you trust within your circle. Also, you are the you are the CEO of your life. You are the CEO of your social media handle. It is not a must that you accept each and every friend request that has been shared with you. You have an option to filter out whom to follow and whom not to follow. You have an option to filter out whom which type of content do you want to reshare and retweet. And then also when you go to now that is reliable, not everything is true on social media. Some information are very fake. So before you share, rather pre-post any content online, try to validate and assess that information first before you share it out. Don't just forward information. They might land you into trouble. And lastly, sorry, tell someone about your concern. I know our women and girls have been violated online. through body shaming, even men. So this issue, don't allow it to end into committing suicide. Share it with someone so that we can work together to find a solution on how best we can solve this issue. Once again, I've put in this slide the reporting mechanisms in which you can use to report these cases for Kenya. And additional tips: don't agree to post sexualized messages. Please don't allow yourself to do that. Also, delete unused account. Don't have so many accounts that might land you into trouble. Also, avoid public Wi-Fi such as the malls and the coffee shops. And if you're always away, you can use VPN to connect to this this Wi-Fi. Create strong passwords to secure yourself online. Block strangers trying to reach you online. Not everybody is your friend online. All right. Otherwise, that's the end of my presentation, and looking forward to hearing more from you. But remember, always remember to be smart when you are online. Thanks so much, and back to you, Rose.
Thank you so much, Tonny, for sharing quite some good information with us. We would like now to hear the questions that come from our participants. Mr. Collins, could you please share some of the questions that are there with us so that our panelists can share their insights to everyone?
So, thank you so much, Phidilliah. In no particular order, as they come. So there was first a question around trends. So Febron is asking, what are some of the, and this is specific to Uganda, and there's a similar one asking about also the other countries. So what are some of the technology facilitated GBV interventions in Uganda? So Edith, if you could talk to some of these, of what these interventions that you know of that are addressing TF-GBV in specific to Uganda. There's one similar to one, of course, in Tanzania, asking the same about such interventions in Tanzania. But then also Tarafina is asking how are organizations, individuals, and service providers, and this is to all the three countries. So how are they interested to know from you, speakers, the organizations, individuals, and service providers in Uganda, and how they're integrating sexual reproductive health and rights into their responses around tech-facilitated GBV. So I'll start with those two, and then there's quite more. There are about 5. I can read all of them. So let's start with those two, and then we go to the rest. So Edith, you want to start us off? There was a question about what are some of TF-GBV interventions in Uganda you could share with the with our conversations today, and similar about that for Tanzania as well.
Okay, thank you so much. One of the GBV interventions in Uganda, we have digital literacy trainings. These digital literacy trainings are mostly done by organizations. I know organizations like Women and Girl Child Development Association, Forum for Women in Democracy, and many other organizations. They organize digital literacy trainings in villages, in towns for women. And during these trainings, they teach them about that online technical gender-based violence, how they can overcome it. Yes, they tell them to make their information private, like they give them tips. And then we have platforms for reporting online gender-based violence. I'm going to share the Uganda Police Forces online GBV number. Yes, we have online platforms for reporting. Any help you need, don't commit suicide, don't be offended, just share and speak out. And then also we have social media campaigns. Here we leverage social media to raise awareness about GBV. Yeah, social media campaigns. Our organization basically does that, and many organizations do that. Yes, there is cybersecurity training. Here They equip women and girls with skills to protect themselves from online harassment and cyber stalking. Yes. And then also the collaboration with technology companies. Yes, to address online GBV. So these technology companies are more advanced, they have solutions, we bring them on board. Yeah, that's what I can say for Uganda. With more, I'll share the toll-free number. Thank you so much.
Katanta, there was something about Tanzania for the same.
Dr. Katanta, Dr. Katanta, can you hear us?
Well,
hello, I was speaking while muted. Sorry, I was speaking while muted.
Go ahead. Dr. Katanta, could you please answer the question on
sorry, I'm speaking while I'm muted. So I think the question was about the intersect, something like that. Am I correct, Tonny?
So there are two questions for you. So one, someone was interested about the interventions in Uganda, the interventions in Tanzania around TF-GBV, and then two, there was a specific questions around around matters of it. So start with the one about other specific interventions around TF-GBV in Uganda, in Tanzania. I don't know why I keep saying Uganda, in Tanzania. And then there's still another question coming to you about the intersex aspect. So start with the first one, please.
Okay, so talking about the TF-GBV intervention in Tanzania, as I have mentioned previously in my presentation, there are a number of interventions and program interventions which are happening. We are seeing, for example, Tangible Initiative, which is an organization supporting local organizations to design and implement programs which will address and respond to issues around GBV and violation using technology. And through that one, it has capacitated a number of organizations in the country. For the first time in 2022, we have TF-GBV exhibitions, which did happen to Julius Nyerere Convention Center, whereby different stakeholders were there, including the government, which was represented by Parliament. They have also their interventions using the technology to address the issue of the TF-GBV. But at the same time, we are seeing organization like Human Rights Center Legal Service Facility, which has Haki Yangu, Sheria Kiganjani. I mentioned about the mobile tracking systems. This system, I really love these systems, the interventions, because first of all, they're just using a normal phone, but at the same time, they are really encouraging to report the GBV, which is happening at household level, including the intersects. And they are providing platform for reporting, and they are doing triage. If you go back to their system and designing, they have developed something called service directories of the actors who are providing service for GBV survivors. So automatically the system itself, once you log in, once you write a message, they will prompt you by asking some few questions, which will help the system to do triage and direct you where exactly to go. And it's really time. And if there is any sort of delay of providing the response, it will cascade to another level of management of that case. So, for example, last year, we had witnessed 1,064 cases which have been reported, and they were responded as well. The perpetrators were held accountable. Some of them have been jailed. We have a number of girls, for example, almost like 91 girls were rescued from FGM. You can just imagine, just red-handed people were caught. They were just about to make the cut. We have some cases of forced marriage and child marriage. You know, some of the perpetrators have been held accountable while wanasherekea harusi kabisa yani. So someone just sent a message, just went there to the wedding, says that, but these are students. How is it possible it's happening? Just send a message and immediately we're held accountable. And we know some of the girls have been taken back to school. It's unfortunate some of the girls were found already being pregnant. So it's a bit of challenging. So there are a number of interventions. For example, there is a program under WILDAF, also is called the Funguka app, which has almost like 4 sections, in which if you have any case, any sort of such kind of queries, you want to get some sort of information, it will let you know. But apart from that, we have very strong social media handles. For example, the ones which I mentioned from Marisa, Gorisa and Marisa, has been holding people accountable, has been serving and supporting a number of individuals who have been experiencing a number of challenges and violations within the organizations, within the family.
Katanta,
yes.
To add on to that, because there's a question that looks like you'll have to leverage on the same knowledge that you're sharing, and I'll read it as it's shared. It's what emerging trends and technologies in East Africa could influence the landscape of tech-facilitated GBV and its intersection with SRHR, and what are the ways that this can be managed? I think this is one, it's a question that integrates very well with what you're trying to share. Could you delve in further and give more insights on that particular question? Dr. Katanta?
Thank you. As if I started mentioning when we were starting the meetings, I said technology has both sides. So we are using programmatically technology, especially for sexual reproductive health services, to provide services currently in the country. A number of organizations, for example, Management of Disease and Health, MDH, in gender health, I know EPIC, TMAC, they have been using the technology to provide informations on various services which is available. For example, we know issues around sexual reproductive health, particularly for young people. There are a lot of challenges for them to go and access the services at the facilities. So we found the best way currently in the country, leveraging availability of the technology opportunity, to start providing the information. There are numbers which have been given free, people can call. There are spaces where people can ask some questions. For example, we have one app which is talking about SRHs, issues around HIV and menstruations, whereby young people, they just go in private and ask the questions, they get the directions, they even get the appointment to go and see the service providers and clinicians. So those are the opportunities. Now, for example, to set your appointment for screening for HIV, we are seeing organizations like MDH, they are doing so, and setting appointment for specific service. For example, recently we've seen a number of young people, they are asking for services like screening for GBV, screening for SECAP, cervical cancer screening, but at the same time getting family planning services, which is a great opportunity. And we have seen also a number of civil society organizations, for example, talking about the HIGH initiative. There is something called TDA. They are helping small organizations, but small social media handles and social media influencers on how to package the messages, to design the apps, which will allow the interplay and the interactions between the client and the service providers. So yeah, that's what I can say.
Thank you so much, Dr. Katanta. Thank you so much. So we have another very interesting question that is literally directly linked to our current Olympics. And request Dr. Tonny, Dr. Yvonne, to answer this. And it's asking about the consideration of the intersex children, but I also think now adults, not only in Tanzania, but also globally. This is in regards to in reference to online bullying, as with this has been seen in the Olympics 2024 in France on an Algerian boxer and a Tanzanian woman footballer. How does intersex online bullying, how does it look like? What is its face when you're talking about tech facilitated GBV? And what do you think that does to a person, especially now, like in reference like to the athletes? How does it affect them mentally and psychologically, holistically? How does it look like, and what are the things that they can actually take up or seek as support and interventions? Dr. Yvonne, please share with us your insights on that.
Yeah. Thank you, Loz. I think this is not gonna be specific to maybe the intersex or like what is taking place into the Olympics games, but what we all need to agree together is that TF-GBV is also a valid form of GBV, and it affects the victims in the same way, if not worse, like the other forms of the GBV. So, however, learning from one experience, like the experience that we had in Rwanda, my host organization, as well as HDI, where Annonciata comes from, together with other global partners, we did a research across 7 countries through the Generation Gender Program to analyze the situation of TF-GBV and to get an idea of how we can include it into our programming. And so the results set out some of the alarming call to inform the programming. Some of the major recommendations for the TF-GBV intervention were, first of all, to make sure that we have evidence. How are we informed? How much are we informed about TF-GBV? And if in case we plan to program it, do we have tangible grounds that we can base on to make sure that our programming, our interventions to combat that TF-GBV in all forms is informed, is evidence-based? So the first one is to conduct researches across our countries. And this has been seen from the presentation of my previous speakers, that there is still a gap into the data around the TF-GBV, which can inform us on what to do next. And the second, TF-GBV is alluded to multiple situations, like which has alluded into the patriarchy and the other pertinent roots of GBV in general, which translate from the offline community to the online community. So basically, it's quite easy to predict if people are, having GBV offline, what is supposed to be online. What we do, like the online environment makes things get easy done. So that's how it is easy to do the GBV using the online environment as well, because of the evolving technology. So the awareness is very much needed also to dive into a transformative journey of our community to make sure that they leverage technology positively and combating all the negative forms of that can pose a huge negative impact to a wide range of people. The third part is legal reform. Across all the countries, you see that we have very vague laws around GBV, sorry. there is a need to recognize the specificity of the TF-GBV and be able to influence the legal reform to make sure that it captures it in its nature. So the reporting, multiple people talked about the channels of reporting, and we need to revise that, to revisit that, to make sure that whenever somebody is reporting, there is a way to channel the evidences, and also to not aggravate a person being a victim, so the violence. There is the gender and the patriarchy. I talked about it, about our society, and there is also the adaptability. We need to design intervention to keep up with the evolving nature of technology, while safeguarding mechanism to target the prominent forms of TF-GBV in each context are in place. So basically, it's a holistic approach that we need to take into consideration, try to learn about the TF-GBV as a whole, not into disaggregation, but because the same way it can attack, victimize an intersex, an LGBTQI, a male, a female. So there is always that aggravation, like a person being a victim is really huge. So can we afford to keep learning into that environment? So we need to create those adaptability programming moves and make sure that it falls into our ongoing programs in our respective organizations, and also to the government level, influencing the government level, at policy making level, legal reform.
Thank you. Thank you. Thank you so much, Dr. Yvonne. We have one question, and I think Mr. Tonny Olela can talk about this. And it touches on why we need to take discussions a little bit back, dial it a little bit back, and especially for adolescents and pre-adolescents who are using social media for fun but lack the understanding of the do's and don'ts and how they actually contribute to it. And they don't know what tech facilitated GBV is and how to identify it when it happens to them. And so that, because we do not want to let this key population behind, because they are actually the majority of the population in Africa currently. What are the measures that you think we can put in place, or we can put at the grassroots level, which is not which can be easily implemented without associated costs, and that can be easily assimilated by the adolescents and pre-adolescents? It doesn't look like an attack to their use of social media, but an upskill on how they can actually contribute without knowledge to TF-GBV.
Right. Thank you so much for that question. I feel like saying Gen Z occupy, but in this context, just to respond to it, what I can say is yes, indeed, that special group, there are many in number at the moment, statistically, and just to ensure that the adolescents are not left behind in understanding the TF-GBV, it is very essential to take a proactive and educational approaches that really resonates with their level of awareness and understanding. So the best way to do this is introduce age-appropriate educations, that is through workshop programs, school programs, and also interactive learnings by utilizing of the games, quizzes, just trying to be very creative in handling their social behavior change that fits the context of their own understanding. We can also create safe space for them to have these conversations. I know when we were in some engagement at RHNK, we were having a youth cafe where we were openly having peer-led discussions and conversations about GBV and SRHR. So how best can we maximize this in the communities where we're coming from, and bring in the voice of the adolescent and young people? Because remember, we also need their voices in these spaces. We also need to maximize on social media education, by using the most popular platforms that these young people use. Let's say TikTok, Instagram, and all other aspects, all other avenues that these adolescents can be reached out. Also, digital literacy, can we have scripts acted to address these issues? Like, I know I've engaged in this at the moment. We were trying to reach out to universities and learning institutions to talk more about the TF-GBV. I think this is also another approach that can be used. Also provide resources that are well laid out to explain in details, just like the first video that was played explains it. They need to know the effects, the statistics, and all those. Also more of providing positive online behaviors, what they post, how they comment, how their image on social media also matters the most. Yeah, and definitely just continuous engagement, feedback, checking on these young people, engaging them in intentional conversations that can really address these issues that they are facing. Thank you, and over to you, Rose.
Thank you so much, Tony. That's really nice. We have so many questions flowing. Please do not hesitate to post them on the chat. We will take, if we might not be able to answer all of them, but worry not. We'll be able to share them on our different platforms, on X and on IG. We'll be able to get feedback from you people and also share insights from our team of technical advisors and specialists. One question that I would like to pose to one of our panelists, and that is to Mrs. Annonciata. Could you please share your insights on the impacts of victim blaming on individuals who have experienced technologically facilitated gender-based violence, and how, as a community, we can best support these victims, or better said, survivors of tech-facilitated GBV? Ms. Annonciata, please, will you answer the question for us? Ms. Annonciata? Hi, sorry.
Thank you so much. I was saying that people, survivors or victims from TF-GBV or GBV in general are in need of support from the society, from the family, from the whole community. And I will maybe share the experience of the organization for which I work, which is HDI, Development Vision. And for survivors of GBV, what we provide is firstly a counseling session. And we do provide medical and legal aid.
We seem to have lost you, Annonciata. Oh,
I was saying that on behalf of, by experience, do you hear me, please?
Yes, I can hear you.
Yeah. I was saying that by experience from the HDI work we do with survivors from GBV or TF-GBV, what we do provide is mainly support based on by providing counseling sessions, by providing medical and legal aid when it is needed, by also providing safe space to discuss all these issues of in order to inform our programs. And another thing we do, we have a hotline, a toll-free hotline, where people, victims from TF-GBV or GBV in general can call their case, and be supported in order to get assistance or support to rehabilitate, to have rehabilitated them into normal life.
Okay.
So we have also an app called, we have developed an app called USSD GBV Transport, where people can get information about GBV, types of GBV, where they can refer to once they face GBV, how they can report, and where they can get support. Thank you.
Oh, thank you so much, Annonciata. And to add on to that, on our chat, Edith Atim from Uganda has shared a helpline, a toll-free helpline, and can be able to, I hope that's visible to everyone calling, and they can be able to have access to that knowledge. We would also like to bring in one of our members, who is none other but Mr. Jeff Edmiades from Avenir Health and the DHS program, who is also currently piloting some questions and at the prevalence of TF-GBV for women in Zambia, Lesotho, and Nigeria. I'd like to welcome him so that he can be able to share with us his insights and experiences. And hopefully we can be able to have a more depth understanding on not only just what happens in East Africa, but also in West and Southern Africa. Collins, is he available to take part? Or Mr. Jeffrey, please.
Can you all hear me?
Yes, I can hear you.
Fantastic.
I can.
Thank you so much for the very interesting presentations and the very careful thought that has gone into how to conceptualize and think of tech-facilitated gender-based violence, and then, of course, how we can intervene to help prevent it or also, of course, mitigate the effects of it. Here at the DHS program, we've been very interested in this question as well, and trying to understand how we could think about measuring tech-facilitated GBV more effectively in our surveys. And so, as I noted in my comment, we are pilot testing a set of questions in these 3 countries. The questions are put as part of the domestic violence module, which allows for greater protection of responses and confidentiality and so on, and is very focused on trying to understand prevalence at the moment. And so really, I think the key thing is these questions will be asked of all the women who participate in the gender-based violence module in these 3 countries. And the data will be available when the surveys are completed and all the data is processed. As you know, unfortunately, that can take quite a while. But once they're available, I think for the first time, really, we'll have comparable data between these 3 countries about what the experiences are of women with tech-facilitated GBV, who the perpetrators were, how often this happened, whether it happened in the past 12 months or previously, and what types of violence have happened. And as you know, with the DHS, it's very hard to get questions included, so we're had to be very focused on how we did that. But we're very hopeful that this will provide some actual data that people can use then to promote programs such as the ones that you've been talking about today. And then in the future, if countries are interested, we would be able to potentially add these questions, assuming that they provide good information, that we would be able to add these questions into future DHS surveys if there's enough interest from countries. So thank you. I'm very happy to take any questions or clarify anything further on this, but we're very excited to have these questions for the first time in a DHS and to have had the opportunity to explore them in these 3 countries.
Thank you so much, Mr. Jeffrey, for that. We have amongst us Elish Kelly, who would also like to share some of her insights and to all of us. Ms. Kelly, would you please go ahead? please unmute. Eilish Kelly, you're on mute.
Okay, can you hear me now?
Yes, I can hear you now.
Okay, thank you. First of all, I just want to thank the organisers for this very interesting event. I am actually from Ireland, and I suppose I joined for I suppose a comparative piece. We are starting a research program here in Ireland using existing data to examine the issues around gender-based violence and sexual harassment and sexual violence for that as well. So we have a new agency was set up in our country, which came into operation in January of this year, to examine and look after those issues from a policy point of view. So the role of the organisation that I work with is to conduct research to provide evidence in this area. So as I said, I joined this seminar from a learning point of view, to find out what is going on in East Africa. And I suppose there isn't as much here about technology facilitated gender-based violence here as there is there. So it's very much about learning from me. So I just want to thank today's speakers and also for the opportunity to join you today. Thank you.
Thank you so much, Eilish, for your insights and for sharing with us your thought process. I would like now to hand over to Collins, who will take us through the last bits of the webinar session. But it's really good to highlight that with the discussion that we've had, and I hope that we'll continue to have. We have so many questions. We'll continue the conversations online, especially on the X space. But we can now understand the link between the tech-facilitated GBV and sexual reproductive health as a consequence. Because it's something, if it affects us emotionally, psychologically, and it affects us socially in how we interact, it's definitely going to have an impact on our sexual reproductive health. And it's good that we have these insights and we can be able to now open our minds and have an open thinking on how to locally come up with interventions and solutions that can be taken in by our community from the lower society level. Collins, Otieno, would you please take over?
Thank you so much, everybody. Thank you, Phidilliah. Thank you, Tonny. Thank you, Katanta, Edith, Annonciata, and Dr. Ivod. And thank to all of you who've asked your questions. I know we didn't manage to answer all of them, but at least we made an attempt directly or indirectly. And we appreciate you for coming in and getting this conversation. It's literally 90 minutes since we started. And if you are here on Saturday, I said it will actually move on very fast, would be shocked. And we also shocked ourselves. I think one of the things that I'm appreciating from this conversation, and it's what made us with the collaborative steering committees, is probably then to start this conversation and find out if such information exists. Is there data? Are there systems and mechanisms that talk about specifically technology-facilitated GBV? What are the aspects that then we also need to think about? And some of these things have actually come from the questions you've asked, come from the insights shared from our brave speakers and even yourselves. Some from the insight of the contributions we've just had recently. And as a way of closer to there are a couple of things that have come out and from our own interventions and listening that are key for us as people in this field of sexual reproductive health and rights. That one, as a first stop, that we cannot stop. We have to continue building awareness on technology-facilitated GBV among SRH services, because the same, as someone put in the chat in their questions and the comment, that we can't get away from technology, and the same way that technology is here with us, then it has come with this risk. So we need to build this awareness about TF-GBV among our services and even among the users. A lot of our innovations in SRH are going digital. Our users are using them, and of course, in that same way, there's risk and issues of privacy and information. There's opportunity to integrate technology-facilitated GBV in our response and prevention mechanisms that exist within SRH programming. A lot of conversations here have been talking about GBV response and the opportunities, as Katanta was speaking about, how the same can be used and is being used around TF-GBV response. We all commit to building privacy and safety into these digital spaces. A lot of what Tonny was talking about, what actions we can talk about, what actions we can take individually. You know, that thing about sharing is also, we see something and sharing and we're making it trend. It's part of our responsibility and things that we need to be alert about. There's a lot of opportunities for partnership and allies to work in this space of women's rights and digital rights. And that way, then we can be able to move forward and define something that then helps us to reduce the risk or tackle matters of TF-GBV. And of course, it all comes back to about gender equality, social norms. As we started this conversation, we were all talking about societal norms and how they are either excavating or even reducing attention to matters around TF-GBV. So that's the sum of the recommendations. This is not the end of this conversation. We realize that 90 minutes might not be enough to cater for all this. And I thank you so much, Phidilliah, for taking the opportunity to be able to drive this ship, to have this conversation, and to manage to get us somewhere. So, ladies and gentlemen, I hope for those who have questions and for those who didn't, and for those even didn't get opportunity to speak, you still caught something in this conversation. You still living with something. And what we are going to do and we commit to as members of the collaborative and as a project in the Knowledge Success, we're going to share and send to you who have attended, and for those who didn't manage to attend but signed up for this, a recap of the conversations we had in this webinar, and we're going to share this this to you in your emails, plus the recording, and of course there are a number of resources that our specific speakers had and prepared, from their slides to other additional resources, and we'll put all this together when we send it to you so that then you have something to actually refer to and continue in these conversations with. The International Youth Day is coming, being marked very soon, and for those who, I challenge you to go and look at the theme this year, and it really, really relates to aspects of digital. And I think it is also important that for us situating this conversation here was also to align with that, so that then we are aware that there are also risks in as much as there are benefits around this space. And they are saying that there's always a statement in our part of the world in East Africa that these digital spaces and these technological spaces are for young people, or are being driven and agendaed by young people. So it means even on that day where we all celebrate and reflect on the gains we made around young people internationally, then with this year's themes, it's important to also reflect back on this. So we are saying this is not the end of the conversation. We are almost for us, we hope to have sparked something in you to think about and to reflect about. We welcome you to be a member of the collaborative if you are not a member of the collaborative. It's our community of practice where we have such conversations. We're not even not through webinars, but through WhatsApp groups, and even engage and connect. And one of the things we have in store for you, and we invite you to have, is we are having an event coming soon, which is actually showing on the screen. We have what we're calling a lunch, learn and chat, which is a 4-part series, getting to hear from some of our some of the people within East Africa, who we call them our knowledge management champion, that then you're going to share some of the interventions that you're handling and how they're incorporating knowledge management and applying knowledge management in their day-to-day. So we are inviting you to this. We'll immediately, the course of this week, we'll be seeing promos and materials out. Come, let's hear, chat and relax conversation and hear how, our first speaker is Mr. Innocent Grant, who some of you know very well in Tanzania, going to share about the experience on how they've been implementing FPSRH initiatives and how the ways in which they've been trying to apply and integrate knowledge management in their day-to-day work. So it's part of us seeing how knowledge management happens in practice, but also get to hear from our colleagues in the community of practice. So watch out for this. It's going to be on the socials. Our main platform on X is at AmrefICD, but even we will see a lot of posts on LinkedIn through our individual accounts. So look out for that, and we welcome you to engage, ask more questions, help us extend these conversations. And like Phidilliah said, we hope, and we'll try to put all these questions on X as well, some of those which we didn't happen to answer here, to just get a sense of what the rest of the world and the rest of the community say. So with those many words, I thank you so much. And thank you so much for your time. Thank you so much for your accepting our invite, and thank you so much for your participation. On behalf of everyone in the room, on behalf of the team behind the scenes who are members of the steering committee from the collaborative, thank you so much. Thank you so much. Thank you so much.